right. Thanks so much for joining, everybody. Welcome to the KPI seminar by MicroWise. So let's get started. So before we get started, I just want to have a quick disclaimer. Everything that you learned today in the seminar, you want to make sure is verified. We can't be liable for any loss incurred due to the information in the seminar. Okay. I'd like to introduce our presenters. So we do have Robert Gabriel with us, as always. My name is Kim. I'm going to be assisting with the seminar. I'm a product specialist. We also have Mohammed. He is one of our medical billing team leads. And we also have Jasmine, who is another medical billing team lead. Robert, would you like to address everybody?
Sure. Thank you so much, Kim. Hello, everybody. Thank you so much for joining. Thank you for taking the time out of your busy schedule to join us today. Today is a very important meeting. Just a reminder, this meeting will be recorded. We will make that recording available to everyone. So everything you share with us today in the meeting, it will be made public. You're going to hear this over and over again. Measuring is so important. As we always say in business, what's not measured is not managed. So you need to make sure that you're measuring everything and you're managing your numbers. KPI, just in case if you don't know what a KPI is, key performance indicators. In any business, in any job, in any career, there's always a KPI. The KPI in RCM or medical billing, we're going to go over the things that you should be measuring. Now, some of the information that you will be learning today, maybe some of you have a medical billing software that has a report that measures this for you, but it doesn't matter if you have it or not. We're going to show you how to calculate it yourself if you don't have it, because if you have it, you know how it's getting calculated. So tracking your KPI is give you visibility into your revenue cycle, and data-driven decision always reduces error and maximize profitability. So we want to always have the maximum profit you can have, and we want to reduce as much errors as possible, because obviously that will translate to more money into your pocket and the owner's pockets. What you're going to learn today, we're going to learn some of the KPI that we think that you should be measuring. And those are the things that we measure ourselves when we work with a practice. Now, there's no one size fits all, but those are generally the most important KPI that we ask everybody that you should be measuring. Then you might have different KPIs for your practice. So if needed, then we can discuss that in a private session. But those are the things that we're going to show you today, how to measure and what to measure. So days in account receivable is important. Net collection rate, gross collection rate, the adjustment percentage of revenue, and the AR percentage, the claim rejection rate, the average reimbursement rate, and patient collection rate, and of course, the no-show rate. We're going to show you how to calculate all of that. Now, the first section, Jasmine is going to do that. But before Jasmine, we like to know who's on the call, and we have a few survey questions for you just to know who's with us. And so this way you get an idea of what we have. Okay, please answer who's on the call. Are you a provider? Are you an office manager for a practice? Are you a medical billing staff, or you are a medical billing company? All right. No, I think we have 100.
Like 100% answered. Yeah.
Okay. We have 6% providers on the call, 33% office managers, 39% medical billing staff for practice, and we have 22% of medical billing companies. Okay. So let's go on with the next question. We just want to know what software you're using today. We have Medisoft, we have Lytec, we have Aprima, and we have others. Okay. So let's end that and let's share what we have, everybody. We have 65% of Medisoft, we have 22% of Lytec, we have 4% Aprima, and we have 9% of other softwares. Okay, we're going to go with the next question and final question for this section. Then we're going to have Jasmine get started. Okay, are you doing billing in-house or are you outsourcing? Now, if you're a medical billing company, you don't have to answer that question. Okay, let's show the results. So 94% is doing billing in-house and with 6% is outsourcing. Okay, very good. Let's go back to Jasmine, and Jasmine is going to show us how to calculate some of the KPI that we talked about. Okay, Jasmine.
Thank you, Robert. Hello, everyone. Welcome to our webinar today. Thank you so much for taking the time to join. Let's start with the first metric or indication that you can use to know the shape of your practice billing. Let's assume that we have Dr. John Doe practice, and Dr. Doe would like to or wants to run some numbers to know the shape of his practice. Indicators are, the first one is the days in account receivables or the days in AR. Days in AR is usually how to measure or let us measure how quickly the practice collects the payment after billing. How actually can we calculate the days in AR? The days in AR, we need two numbers to be able to calculate them. The first number is the AR amount or the total amount of your outstanding claims, and the second number is your average daily charge. So let's assume that we are in the month of September, and I would like to know what's the days in AR for the month of September. The first number that I have here is the AR for September, which is 1.5 million. And this is all assumptions, of course. And the second number that I would need is the average daily charge. In order for me to calculate the average daily charge, I would need to get the total of the charge amounts for the past 3 months or the 3 months that are before September, which are June, July, and August. So I will calculate the total charge for June, July, and August, and then I will divide that number, the outcome, which is for our example, is 3.5 million over the number of days in those 3 months. And we're talking regular days, calendar days, not business days. So that's the first formula that we're using. To calculate the days in AR, we need two numbers and two formulas. The two numbers, as we said, is the total AR. The second number is the average daily charge. And the first formula is how can we get the average daily charge, and then we move to our final formula, which will result in the number of days in AR. So right now I have 3.5 million. That's the total charge amount for the past 3 months and the number of days for those 3 months. So I will be dividing the total charge amount over the number of days, and the number that will result here that will give me the average daily charge. So 3.5 million over 92 days, it will give me the result of $38,043. So right now I have my two numbers that I can calculate with them the days in AR. So I will take the current outstanding AR, the 1.5 million, and I will divide them over the average daily charge, which will give me the number of 39 days. Usually, the recommended days in AR varies between 30 to 50 days. However, always remember that your practice specifics matter. The insurance that you're dealing with, they do matter. If the majority of your insurance is workers' compensation or auto, definitely you might see different numbers that might be more than 50 days, because as knowing those insurance, they usually take longer than, for example, Medicare. Always remember that your practice specifics or your business and the conditions around it do matter, and it will affect those numbers. The next number or the next indication that we usually use or it's recommended to use is the net collection rate. Usually the net collection rate it indicates the percentage of the collectible claims that the practice or your practice successfully collects. How can we calculate or indicate our net collection rate. So the first thing that we will use a report, it's using a report that shows or that will give you the number of claims submitted for a certain date of service. And remember, in order to successfully calculate this number, you have to be working within a specific date of service. Not a day, but like a certain period for the date of service. So I'm calculating how many claims did I submit, for example, for the month of December of 24, and how much of them got paid. So let's assume that Dr. Doe, he submitted 20 claims during December, and he got paid on 18 claims out of the 20. His collection rate or his net collection rate, it will be the 18 claims that got paid over the 20 claims that were submitted times 100, which give us the percentage of 90%. And this is for the month or the date of service of December of 24. And the healthy range, it usually varies from 90 to 95%. And above 95% is ideal for you. As always, remember that your practice specifics, they do matter. And when you are actually measuring those numbers, do matter as well. Because like I cannot run those numbers, for example, for the month of January of 25, because I'm still within that month. Usually running the net collection rate, it's preferable after 30 to 5 days from the date of service. But for example, if you're running it for January of 24 and you found that only 20% of January claims for 24 got paid, then yes, that's not healthy for your business or your practice, and there must be something that's going on, or it depends, of course, on how things are going within your practice. Then we move to the next part, which is the gross collection rate. And this reflects the percentage or the total charge that are collected. And they do include the non-collectible charges. How can we calculate this amount, and what does it actually indicate, and how can I use it? Let's assume that I have two psychiatric providers. They are located in Idaho. And those two providers, their total charge by the date of service is $31,694. Just to explain before I go through the numbers and do all of the calculations, the gross collection rate, that's the total payment amount that you received for certain range for a date of service divided by the total charge amount. So the two providers that are located in Idaho, they submitted a total charge for the month of December of 24, they submitted a total charge of $31,694. And their total payment for this date range is $25,826.82. So gross collection rate will be the 25,000, the total payments over the total charges, the 31,000, and it will give us a percentage of 81.5%. We have another example, and this is for a podiatrist that's located in New York. So the total charges for the same range date of service for December of 24 is $80,595. And the provider's total payment for the same date range is $55,609.73, which makes their gross collection rate 68.9%. So why are we using those numbers if this is only for gross collection rate, especially that those numbers are controlled by different factors and different factors attribute to them? Usually those numbers can be, or they are preferable to be ran So you will be able to tell if you are inflating your charge amount. That's the first thing, or you're actually charging less than the usual fee schedule or the average fee schedule with your contracted insurance or payer mix. And it can be used to know what are you expecting to get paid. It can be an indication. For example, you can run this for the AR. Like, for example, I have a certain amount of AR and I would like to know how much I'm expecting from the insurance if that entire AR is completely paid by the insurance and finalized. This percentage could be used as an indication. And last but not least is that as a provider, this percentage could be used as an indication to know if the insurance is actually paying me less than what's suitable for the market or what makes me profitable. And this takes you to a very important thing, which is, do I need to do any contract negotiation with my contracted plans or not? Are they paying me what I'm expecting or not? So if the charge amount is very high compared to the insurance fee schedule, this will lower the percentage for the gross collection rate. So there is no right or wrong answer when it comes to the gross collection rate. It totally depends on your business, the payer mix that you're dealing with, your fee schedule with the insurance. Because if Dr. Doe is seeing only commercial plans and Medicare, but he's not taking Medicaid, definitely his fee schedule is completely different if he's majority of patients and majority of the insurance plans that he's dealing with is Medicaid. So that's another example. This shows or represents 4 CPT codes and their correspondence fee schedule versus the total charge. So the first example that we have here, the total charge for the 4 CPT codes, and let's assume that Dr. Doe is actually charging those amounts. And that's his fee schedule or the average fee schedule with the majority of the insurance plans that he's contracted with. And usually the insurance, of course, they will pay what they have on the fee schedule. The payment amount for the 4 CPT codes, it totals up to $400. If we calculated the payment amount over the charge amount or the inflated charge amount here and what it's recommended for him to be billing, because this is closer to what his insurance contracts has the fee schedule for the CPT codes, we will find that the difference between the percentage, although that on like $465 versus $436 is not very high, but when it comes to running those numbers, it definitely affects the percentage. We actually have a question for you. And before we go to the question, I would like to let you know that collecting the patient payments and, of course, the remaining balances from the secondary insurance company, they typically take longer than the primary insurance payments. And this can also impact the gross collection rate percentage. So always make sure that there is a timely follow-ups to minimize delays and maintain the collection efficiency. So we have a question for you. So it will pop up on your screen, and please go ahead and answer this question. The reason why we are asking this question is that when it comes to the contract negotiation and how much you are getting paid from the insurance, is that it's regarding the MAPS reporting, which is the Medicare reporting. And the MAPS reporting for the providers that should be reporting and the MAPS is applicable on them, qualifying to MIPS and actually meeting the criteria, it can affect the fee schedule or the amount that you are getting paid from Medicare.
Yeah, we'll share the results here. Okay, so it looks like we have 22% that are aware and do not report, 28% are aware and do report, 17 is not applicable, and 33 are not aware of misreporting.
Thank you, Cam. Okay, so this takes us to the next indication or the next KPI indication, which is the adjustment as the percentage of revenue. This indicates the total amount adjusted off due to whether a contractual agreement, write-offs, or any other reasons. How can we calculate that? And this is so similar to the gross collection rate. It is actually controlled by how much you charge, because of course, if your charge amount is extremely higher than your actual fee schedule with the insurance, this will increase the adjustment amount. So we have a table that demonstrates a sample of CPT codes and their total charges versus their total adjustments. So how can we calculate the adjustment percentage? So we will take the total adjustment, and this is also based on a certain range for a date of service. So we're still working on our same example, which is December of 24. So we had a total charge of $1,052, and the total adjustment amount for those codes is $232. So we will divide the 232 over the 1,052, and this will give us the percentage of the adjustments that's happening. The healthy range is usually from 20 to 35%, and this definitely varies by the payer mix. And it depends on, as we indicated, the charge amount that you are charging and your practice specific. And leading to the last part of me presenting here, and then my colleague Mohammed will be taking over, is the AR percentage. And this is very important when it comes to indicating or measuring how your billing is going on. So the AR percentage, it indicates the outstanding claims that remain unpaid within a specific period, and it reflects the practice efficiency in collecting revenue and managing their receivables. So how can we calculate the AR? Usually, there are reports, of course, and it depends on the system that you are using. But what if that you want to calculate it manually, or you want to see this, you want to do the numbers manually? So usually majority of the systems or majority of a practice management system that anyone would use, they would have an AR or a report that shows how much is outstanding within certain buckets. So the recommended buckets that are usually used are aging from the date of the claim that was submitted. So this bucket, the first one is 0 to 30, which indicates that those claims were submitted aging 0 to 30 days, and then 31 to 60, and then we have 61 to 90, 91 to 120, and then we have the highest, which is plus 120 days. And let's assume that those are the numbers that are outstanding within each bucket. So we have the total AR. The total AR is $950,000. And by dividing the AR bucket, so if I want to know the percentage of the 0 to 30 days claims that are outstanding, I will take the 712,000 and divide them over the 950,000. And this will give me the percentage of the percentage of the claims that are outstanding. The 0 to 30 are usually the good ones, because the majority of the insurance or commercial insurance, to be specific, their turnaround time, it takes around 30 days for a claim to be processed and paid. But anything that can be more than that, this would be recommended to followed up on and worked on. And as specified, this is definitely depending on the insurance that you're working on. The claims that are older than 0 to 30, those are the ones that we consider a workable AR. And the percentage of the claims that are older than 30 days, usually it's recommended that they shouldn't be more than 30% of your AR. As indicated or as mentioned, this is totally depends on the payer that you're working with, and as well whether this claim is outstanding in the primary insurance bucket list or the secondary insurance bucket list. Because when it comes to secondary insurance claims, usually the healthy raging for them can be up to 60 days aging. And this is my part. Thank you so much for your time. My colleague, Mohammed Zain, he is one of MicroWise great team leads. He will take over and explain the next part of the seminar. Thank you.
Thank you, Jasmine.
Thank you, Jasmine. Thank you so much for your explanation regarding the KPIs. And thank you everyone for joining us today. And let's move forward with the 4 remaining indicators for our KPIs today. So today I'm going to be going through the claim rejection, the average reimbursement rate, the patient collection rate, and the no-show rate. So let's go ahead and get started with the claim rejection rate. So the most important thing to know about claim rejection rate, it tracks the percentage of claim rejected due to errors before processing. So, but before we go ahead and get started, first of all, we need to understand what's the difference between rejected claim and denied claim. Rejected claim means that the claim is being rejected by the clearinghouse and it didn't reach the payer, so it didn't go through a processing system, didn't go through the adjudication system for the payer. And denied claim means that the claim reached the payer and the claim got processed, whether it's paid, denied, or pending for medical records. Let's have a small example that can show us how we can calculate the rejection percentage for our practice. Let's assume that if we have submitted 100 claims and 10 of these claims were rejected for a reason or another, in order for us to calculate the rejection percentage, we need to have a formula for it, which is the rejected claims over the total submitted claims for a specific period. And that report can be easily managed through any clearinghouse. Whatever clearinghouse you guys are using, you can have this report easily from it. So then we divide the rejected claims over the submitted claims. As you can see, we have 10 claims got rejected over the 100 claims that we have submitted. And we have a 10% rejection rate. So our clean claim rate for this period is 90%. And the healthy range for this rejection ratio is 94 and above. Below that, it means it's a bad indicator for your practice that mostly that your claims are being rejected and you need to work on them as soon as you can. Moving to the average reimbursement rate. Why we need to know the average reimbursement rate? Because it monitors the average amount reimbursed per CPT code by payers. Let's assume that we have different rates for a certain CPT code, which is 99213. And those are the rates for each payer with a total of $2,027. So in order for us to get the average reimbursement rate, we need to divide the total paid amount over the paid number of units. And now we have an average paid rate for 99213, which is $202.70. The most important thing that you need to know about this part is that you know the anticipated amount that you can get paid for a certain CPT code if you are billing more than one payer. Moving to patient collection rate. Why it's important indicator to know the patient collection rate, it measures how effectively the practice collect payments from patients. How can we calculate that? As per explanation of benefits, as we all know, guys, that the total charge amount equals the allowed amount plus the adjusted amount. And the allowed amount equals insurance payment plus patient responsibility. Let's assume that a patient responsibility is $100 and the patient paid only $80. In order to calculate the collection rate, we need to calculate the actual payment over the patient responsibility. To calculate the collection rate, we have the total patient payment over the total patient responsibility. And as we mentioned before in our example, that the patient only paid 80 out of the $100, 80 above 100. And if you multiply that with 100%, you get an 80% collection rate, which is a good indicator for you. And usually the healthy range is from 35 to 100 to 80%. And we do recommend practices to use a robust patient payment processes. Moving forward to the last indicator or the last KPI indicator that we have for you today, guys, the no-show rate and why it's important for us to know the no-show rate. The no-show rate reflects the percentage of scheduled appointments where patient didn't show up. How to calculate it? If today we have 40 appointments scheduled and 3 out of these appointments didn't show up, and we need to calculate the rate for the no-show. The no-show rate is the no-shows over the total appointments scheduled. So we have 3 dates the patient didn't show up, and we have 40 appointments scheduled during this month. And multiply that by 100, you will get 7.5% of the no-show rate. And the healthy range for you is less than 5%. And we do recommend our providers that use reminders to minimize the no-shows. And the key success in calculation, the no-show rate depends on using a scheduler for you. And again, let's remind all of us that you cannot manage what you don't measure. I'm going to be leaving you guys with a quick survey question with the key takeaways. And the question is going to be popping up on your screen right now. The question is, can you classify the major issue that you do have?
So tell us some of the challenges that you're facing. You can pick more than one.
Just about everybody responded.
Okay, so we're going to show you the results.
So it looks like we have about 22% struggle with low cash, 11% with high denial, 22% with high AR, 11% with high rejection, 50% with collecting patient payments, 33% with contract negotiations, 6% with high no-show rates, 17% with attracting new patients, and 6% with employee retention.
Okay, very good. So just a quick reminder here. I'm sure some of you are affected by, you can ruin somebody's credit score by not paying medical bills. Some people were so scared that this patient will stop paying. But believe me, if you send a professional statement in a steady manner and followed up by calling, you will definitely increase your collection percentage from patient. If a patient received a call from the practice, remind them that there's something is not paid. Having the tools, always provide the tools, the credit card, you accepting credit card, able to send electronic statement, able to accept payment online, able to send a reminder through text. There's so many tools. If you utilize that, I didn't expect that patient collection will be this high, but there's tools and now any of the above. If you wanted to have a customized plan to help you, please reach out to me. I will share my numbers if you don't have my numbers and my contact information in a few minutes. If you want us to measure your KPI, to help you with the measurement, please let me know. I will have somebody help you with the measurement because, as we said, it depends where you are, your payer mix, it depends on your specialty and the type of practice. Your KPI might be different from a podiatrist or internal medicine or anything else. Okay, go ahead, Zain. Let's go over the takeaway. Okay.
Yeah, again, after learning how important KPIs is for our practice, is mainly the KPIs, it's the way that we measure the practice performance overall. First of all, we need to understand our numbers. Tracking KPIs gives you the visibility into your health revenue cycle. Again, and you need to set realistic goals for your practice, using benchmarks to identify areas for improvement and prioritize actions. It's so important, and you need to take an action because data without any action is meaningless. You have to monitor now every now and then, analyze trends, and adjust strategies. Lastly, stay ahead. A well-managed billing processes, minimize revenue leaks, and support long-term growth. Last thing that I wanted to say to you guys, that by measuring, you empower your practice to grow and thrive and deliver the best care to your patients.
Okay, so we're gonna have a Q&A now. So any question you might have, doesn't matter if it was the slide from Jasmine section or for Zain section, so it doesn't matter. You can ask the question. Since we have a large audience today, go ahead and type the question, and Kim is going to help us read the question. We dedicated the time for you to help you. If there's anything that you need explanation or other challenges that you want us to discuss today, sometimes the answer might come from somebody in the audience. You'd be surprised asking the question that people willing to help with their experience. Look like we have a question already.
Yep, you have one. What are your go-to MediSoft reports for some of these KPIs?
Jane or Jasmine?
Yes. So we have some customized report that can be easily tracked into our system. So you have the total charge amount that you can use to filter when it comes to the gross collection. If you need to calculate the days in the hour, that report can show you how much you have billed for any month that you want for a time period, for a specific time period. That's the report that we go to when it comes to the days in the hour. Also, for the rejections, definitely we go to our clearinghouse. That's where we check the rejection percentage, how many claims we submitted, and how many claims have been rejected. Lastly, the average reimbursement rate, we go to productivity by procedure and to Metasoft, and that shows you how much was paid for each CPT code, and you can categorize it by each pair, and then you can calculate the average reimbursement amount for your CPT codes.
And an easy one is the office hours in Medisoft does show you the no-show percentage.
We don't have any other question. John said thank you.
All right, next, you want to put my contact information? Okay, so this is my contact information. I want to thank you so much for taking the time out of your busy schedule. I want to thank you for your business. Please reach out to me if you need anything tailored, customized, or follow-up questions. If you couldn't come up with the questions here, again, you will receive a recording of the seminar. And as usual, thank you so much for joining. Have a wonderful day, everybody. Thank you.
Don't compromise. Go microwise.